If you're a non-medical company and you are looking to see on how you can add more referrals to your agencies, even if you are also a home health agency that's Medicare approved, one thing to do is to start looking into those independent living facilities or those 55 plus community locations. What you want to be able to do is you can actually maybe speak to the administrator or whoever is the person in charge of the community as well, and try to do your best in order to help them learn or provide discharge planning services that's going to be able to assist their residents to be able to get back to their facility. Remember, these independent living communities will be losing money if their residents are not coming back to them and they actually end up into long-term care. So what you want to be able to do is you want to be that guide, that educator, that person that can actually help them get back to where they need to be. One example is providing those free education classes in regards to what they need to do if something happens to them or if they end up in a hospital. Show the residents, show them what they should actually pack with their bags when they go to these facilities. You want to be able to maybe give them a checklist, show them some guidance. Just like, for example, when somebody is pregnant and before they give birth, they already make plans ahead of time. They already pre-pack their bags out there. I'm not telling you to tell residents to pre-pack their bags just in case they have to go, but at least make sure they have a checklist in case anything happens. You want to be able to suggest maybe a pre-packed bag for patients that are always returning back to the hospital. But at the same time, as with this said, you can also provide nurses with these assisted living places where they're going to actually be there to give them free discharge transition planning for their residents. You want to be able to be the person, the organization, the company that's going to be able to guide people back to their homes. Remember, if you are helping people doing this, you're not going to get every single one of them to be your patient. But what you're doing is you're increasing your visibility in the community. If they always remember your ABC Home Health or whatever the home health agency's name, 123 Home Health, ABC Home Health, whatever it is, what you're doing is you're increasing your visibility. And in marketing, ultimately, that is your main goal, is to be able to increase your visibility to these assisted living facilities, these independent living facilities, or independent living communities that are taking care of patients. Look, reason why I said in the beginning of this video is also target the 55 plus community locations is because of this. The 55 plus communities, the people who are at the age of 55 or 60 who are not eligible for Medicare, for example, they may know their loved ones. They may have cousins. They more likely will still have their parents that are going to be needing assistance. You want to be able to target those communities to be able to get you more referrals. And like I said, in marketing, it's a give attitude. You never want to keep on asking. You never want to always expect something. But what you want to do is to be able to give so much that I will guarantee you the laws of attractions will literally say, if you give, you will receive eventually. So you want to be able to tap this community, get yourself out there, expand yourself out there, get your name, your company, your staff to be out there to help people, and we'll definitely get more referrals.